Nikki Bay-Jump, and I am the Program Director for the GYN Oncology Fellowship Program here at UNC Chapel Hill. I also serve as Director for Translational Research in our division and lead our GYN Oncology Clinical Trials Pod. I run an NIH-funded laboratory focused on obesity, African American disparities, metabolic targeted therapies, and endometrial cancer, using cell lines, animal models, and translational and interventional trials. Most fellows spend their research year in my lab, which I love. I came first to UNC in 2000 as an OBGYN resident, followed by GYN Oncology Fellowship, and then joined the faculty in 2007. I have stayed at UNC for all these years due to its collaborative and uplifting environment devoted to all of our academic missions, including excellence in patient care, innovative research, and comprehensive training of the next generation of physicians. I am so excited to meet you on interview day and have you learn all about our amazing program.
Hello, I'm Raven West, the GYN Oncology Fellowship Coordinator, as well as the Division Manager. I've been in this role for about a year now, but in the division for 3. It is unfortunate that you all will not be able to come to see the beautiful state of North Carolina and city of Chapel Hill, but we are very much excited to virtually meet you all, and we can't thank you enough for your interest in our program. Can't wait to see you.
Hi, my name is Paula Garrick, and I have the honor and pleasure of serving as a director for this wonderful division of GYN Oncology at UNC Chapel Hill. I'm sorry that we're not able to meet in person, but I do appreciate the time you're taking to watch the video, and I look forward to meeting with all of you during our Zoom interviews. I've been here since 1997 when I came as a fellow, and never in my wildest dreams did I imagine that I would be at Chapel Hill for my entire career. It really is a hard place to leave, and it's because I haven't been able to find any place better. We have a wonderful team that is very patient-centered, and everything that we do is for our patients. We enjoy each other, we enjoy each other's company, we work hard and play hard. If we can answer any questions for you before you come, please let us know. And I look forward to meeting with all of you. Thank you.
I am Dr. Zhou. I have been working with Dr. Bay-Jump in the lab for 10 plus years. My research experience has been focused on targeting therapy in GYN cancers. I also have a lot of experience working with the fellows in the past 10 years. Our research team welcomes incoming fellows to work with us. Our team members will be very happy to help your research work in the lab.
Hello, I'm Wendy Brewster. I am professor in the Division of GYN Oncology. I also hold an appointment as professor at the Gilling School of Global Health in the Department of Epidemiology. Welcome. Thank you for considering this program. I hope that on your visit here, you learn a lot about us and you're able to answer the questions and get the information you need to make a really important decision about whether or not this is a place you should train. I think this is a place you should train.
Hi, I'm Leslie Clark. I'm an assistant professor in the Division of Gynecologic Oncology. I've been with the division for 3 years now, since finishing my fellowship here at UNC. I am the rotation director for the residents as well as the 4th year medical students, and my clinical practice is divided between UNC Rex Hospital in Raleigh and the main campus in Chapel Hill, where you'll be working with me. Welcome, and we can't wait to meet you.
Hello, I'm Dan Clark Pearson, one of the professors in the Division of Gynecologic Oncology at UNC. What to say about myself in 30 seconds. I was raised in Southern California in the desert, and then went to Harvard for my undergraduate degree in biology, and Case Western Reserve for my medical school. But before Case Western Reserve, I spent a year in a vascular surgery laboratory where I developed my interest in venous thromboembolic complications. Then I came to Duke for my residency in OBGYN and fellowship with Dr. William Kreisman at Duke in GYN Oncology, and then stayed on the faculty pretty much throughout my career up until 2005. During that time at Duke, I was fellowship director and also division director for 18 years. In 2005, I had the opportunity to come to UNC and be chair of the department, which was a great opportunity. I think we built a fantastic department, and for about the past year, I've stepped down, and now I'm a full-time professor in the division, doing some teaching, clearly operating and seeing patients, and a little bit of research. So welcome to UNC. I think you're going to find it a great opportunity, and hope you enjoy yourselves. Take care.
Hi, I'm Lauren Dockery. I'm one of the GYN Oncology faculty. I am new here. I've been here about a year. I came here after doing fellowship at the University of Oklahoma. I did my residency at Tufts in Boston. My special focus is on clinical trials, trial enrollment and development, and investigator-initiated trials. The reason I love working in this division is all of the people. It's a fantastic, very collaborative and welcoming division. And then I also love the patients that we get to take care of. Working at a hospital where you can take care of patients no matter their background, insurance status, and everything is very important. And it's one of the things that I think makes UNC such a wonderful place to work.
Hello, I am Wesley C. Fowler Jr., better known as Butch. I am currently the Associate Dean for Medical Alumni Affairs here at UNC. I would say I am over-degreed from the university. I went to undergraduate school, medical school, residency, left for 2 years in the military, and then came back on the faculty in 1973. We established our division of GYN Oncology in 1975, and at that time I was co-director of the division. In 1978, I became director of the division, and in 1979, we started our fellowship training program, of which I am extraordinarily proud. To date, we have finished 45 fellows. All are doing extraordinarily well, many in national leadership positions. My involvement now with the fellows are in the clinic, and also at the disposition conferences. I do ask tough questions from time to time, but I love being around the fellows. I do not do any more surgery. There becomes a point in time where one needs not to do any more surgery. Ask lots of questions about our fellowship training program. We're dedicated to the educational part. That's where it all begins and where it all ends. Welcome and bless you. Go healed.
Hi, my name's Emma Rossi. I'm one of the GYN oncologists on faculty. I was a fellow here at UNC myself 10 years ago, and while I left for just a tiny bit to go to Indiana, I came back because this place really feels like family to me. And I'm based here in Greensboro for my clinical work, which is one of our satellite posts. But I really love interacting with the fellows and doing research projects and doing some educational work with them. And so I look forward to meeting you all. I hope you love this place as much as I do.
Hello, I'm John Soper, Professor of Obstetrics and Gynecology in the Division of GYN Oncology at UNC.
Hi, I'm Linda Van Lee. I'm one of the faculty members in the Division of GYN Oncology here at UNC. And welcome. I'm sorry we're not meeting in person. We usually have a nice party, get to know you personally, but not this year. I hope everyone is safe. One of my unique hats here at UNC in this division, is as NRG and GOG PI. We've been a NRG and GOG legacy center for quite a while, so our clinical trials are pretty important and they are robust. We have a good critical mass of coordinators and nurses to help, so it's pretty much an important experience that you'll get when you come to fellowship. We, of course, have other studies such as investigator-initiated trials. One of my other hats is editorial work, so I am currently one of the scientific editors for GYN Oncology at the British Journal of OBGYN and associate editor for OBGYN Survey. I'm one of the new editors for Lynn's Operative Gynecology and Relevant to You. I have a lot of publishing and editorial work and always happy to help you create or write a review or paper. One of my other hats then, of course, is I'm one of the international mentors for the IGCS, and that's also quite rewarding. I'm going to take a second to just highlight some of the things I think are important here. We have 12 faculty members, and we all think the same, which is nice. We all get along, try and nurture our fellows, be respectful, and we all really think the same in that our fellowship education is very important. It's actually primary for us.
Hello, everyone. My name is Gabrielle Hawkins. I'm one of the third-year fellows, and I am currently sitting in the fellow office getting ready for clinic this morning. I'll give you a 360 view. All the things you'd ever want in a fellow office. I have been here since residency. I did residency at UNC and then was fortunate to stay here for fellowship. And one of the best things about this place are the people, and I think you'll hear that over and over again. Our staff, our nurse clinicians, the faculty, the residents, everyone we work with are great. And most importantly, we're all very proud to take care of our patients here, and we pride ourselves on taking care of the women in North Carolina. So I hope that you really give UNC a good look, and I hope that you enjoy everyone's videos and your time during your interview. Bye.
Hi, I'm Sarah Paragami, and I'm a third-year fellow. I went to medical school here at UNC, and then I left and went to University of California at Irvine for residency, and was so fortunate to return for fellowship. There are lots of things that I love about this fellowship, but one of them is the camaraderie among the fellows. I'm here in the fellow office, and this is a place where we come together to learn together, to give each other emotional support, and my co-fellows have added tremendously to my experience over the last couple of years.
Hi, I'm Jillian ODonnell. I'm one of the second-year fellows. I did my residency at UAB. When I was looking for a fellowship, I really wanted to come somewhere that felt like home, where the attendings and other fellows felt like my family. And I definitely got that feeling when I came to interview here. Also, the clinical training is unparalleled, high volume, high acuity, great surgical volume, and really good research opportunities.
Hi, I'm Lindsey Buckingham. I'm a native North Carolinian, but trained in Philadelphia at Penn, and came back to North Carolina as I always knew I wanted to. I've been really happy back at UNC and in the division of Gyn-Onc, where I think you're treated like family, and I've had great training this year. I'm joining Dr. ODonnell as a research fellow this year, and can't wait to meet you guys.
Hi, I'm Meredith. I am one of the new first-year fellows. I trained here at UNC for residency, and I was really excited to be able to stay, primarily because of the amazing people you get to work with, from the fellows to faculty to the nurse and staff.
I'm Wesley Burkett. I am another one of the first-year fellows. I've been in North Carolina for about a week now, finishing the onboarding process. But I did medical school at UAB, then residency in Oklahoma. And this program really stuck out to me, just the not only the diversity of the clinical experience, but the surgical volume, and then the faculty, just a very collaborative and communicative group, and I was excited to match here and excited to train from them. Thanks.
Mikia. Hi, I'm Lucille.
Hi, I'm Annie.
I'm Melissa.
I'm Lynn.
And we are the nurse clinicians. Our nursing experience as a group for the nurse clinician is over 75 years, with the majority of that in oncology and GYN. How amazing is that? Our clinical experience varies in chemotherapy, clinical trials, hospice, home health, triage, cardiac, neuro, and the list goes on. As nurse clinicians, we are a valuable resource. We love what we do because it matters and makes a difference.
We triage all the incoming calls to clinic for chemotherapy and post-surgical concerns. We try to meet the needs of the patients and try to get them seen and managed so that you don't have to.
We are there for our patients through the entirety of their care with the Gyn-Onc division. We follow them closely from diagnosis through surgeries, chemotherapy, inpatient admissions, and anything in between. We make a point to get to know our patients and their families so we can better provide continuity of care and assure quality of life through their treatment. We also help to make sure there are no surprises for you, our fellows, when the patient arrives to clinic.
We all work with 2 or 3 specific physicians. We learn what they like. We learn how they like to manage their care for their patients, what lab values they want treated, and when they would like them to see you in clinic, and we will let you know.
Hi, I'm Lexi. I'm the pharmacist that works in clinic. I help to manage all of our oral chemotherapy, as well as work with our nurse clinicians for supportive care for our patients. I am always in clinic, so I'm always around if you have chemotherapy questions, and help to triage any toxicities that might happen with the patients.
Lexi and I together do a monthly course for the fellows called Game On, Chemotherapy for Exceptionally Smart Fellows. So hopefully you qualify. But we do this once a month and cover a variety of topics. At the end of this course, you're practically an oncologist. Go